About 1 in 9 men will be diagnosed with prostate cancer during his lifetime. St. Vincent's Medical Center is focused on setting the standard for care. Joining us is Medical Director and Radiation Oncologist, Dr. Iannuzzi, to explain how stereotactic body radiation therapy works for prostate cancer patients. Great to have you here with us.
Thank you for having me.
What exactly is SBRT?
So SBRT is stereotactic body radiation therapy. Some people refer to it as stereotactic body radiosurgery or just radiosurgery. The word surgery is a misnomer in that there's actually no cutting. It refers to the precision in which we can deliver the radiation beam to the target.
How precise is this?
Within a millimeter.
Wow, that is very precise.
Right. So we have the ability to deliver very high doses of radiation directly to the prostate, and it allows us to prevent that radiation from touching a lot of the normal healthy tissues that are next to the prostate.
And how often does the patient have to undergo this treatment?
So before this, patients would come in every day, Monday through Friday, for a total of about 9 weeks. Now with SBRT, patients have 5 20-minute visits to our department, and then their treatment is complete.
How effective is this therapy?
Very effective. The trials have shown that it's as effective as standard radiation that we have now and as effective as surgery.
Side effects for patients?
Side effects are actually very tolerable. Some patients get some mild fatigue. Some patients will have an increase in urination, which is temporary. Some data seems to suggest that there's better sexual preservation after this treatment when compared to surgery or standard radiation therapy.
Is there an ideal candidate for this?
The ideal candidate for this is somebody who has what's called low or intermediate risk prostate cancer, and that risk is defined by their PSA, how the prostate feels to the finger, and what the cancer looks like under the microscope.
So does that mean a patient who is diagnosed early would be the better candidate for this?
That is correct, yes.
And also the results, the recovery time is much quicker?
There's virtually no true recovery time.
Oh, there isn't?
Patients can actually work full time, they can live their normal life and do all their normal activities right throughout the treatment course.
Oh, that's wonderful. And let's talk about the guidelines for prostate cancer. There have been some changes.
There have been some changes. I think it's a little bit controversial, but essentially you should start having a conversation with your physician when you're age 50. If you're African American or you have a strong family history of prostate cancer, they suggest you have that conversation around age 40 or 45.
Excellent. Great information, Dr. Iannuzzi. Thank you so much.
You're very welcome.
And for more information, you can go to stvincents.org.